indigenous knowledge of infectious diseases is really widespread across the continent of Africa. Why is the case of South Sudan remarkable?
The South Sudanese people have been facing a serious health crisis in the past years, even before COVID-19 breaks out. So clinical medicines have been so inadequate in the country, and they cannot reach the rural areas or the mass majority of the people in the rural villages across the country. And their absence has made people resort to finding other alternative to the treatment. So the little drug that reach the rural populations is in form of private clinic and pharmacies run by individuals, maybe semi-trained or not well-trained individuals selling drugs in the rural areas. Recently, as prices of commodities increase due to economic crisis, the prices of such drugs also rises. And so people in the villages could not afford buying drugs. So instead, the majority of people living in the rural areas in most part of the South Sudan rely on combination of treatment. For example, on medical drugs provided by these pharmacies with expensive drugs if they can access, and also rely on herbalists or on African plants provided by traditional herbalists who have experience of getting herbalists to treat malaria and other diseases that are very common, and also equally rely on management of their sick people on the skill of the traditional people who know how to manage sick people in the past. So the combination of the three become the mean of the current treatment in South Sudan and mostly in the rural area.
You mentioned a lot about the indigenous systems that have been put in place. And I guess the question there is, will these structures and indigenous system structures that you're working with, are they able to bear the brunt of the pandemic, or should there be other adaptations from the World Health Organization, for example?
Yeah, our research documented the deep community experience of managing, and also their failure to manage the epidemic and other infectious diseases in the past, and also there is strategies to manage the sick people or prevent people from contracting sickness in case when the Western medical doctors are not available or before they arrive into the masses of the rural population in South Sudan. People in the villages, mostly where drugs are not available or Western doctors are not present, currently are working and updating their local epidemiological knowledge. To understand COVID, add them into the category of their own diseases and to protect themselves like they did with the past epidemics like the cholera and also ebola. So the majority in the villages are trying hard with their resources and also the information available to them to try to protect themselves. And so if they are provided with detailed knowledge about COVID, they will be able to adapt. They will be able to adapt the guideline provided by the WHO, but the information is less available to them.
Just briefly tell us, what kind of impact would you like for the research to have, or what kind of impact is it already having with policymakers?
Like other epidemics that broke out in the past, like the cholera and the ebola, the meningitis in different parts of South Sudan. So this infectious disease and epidemic exposed the wide gap between the policymakers and also the health authorities, like the health interventionists and the residents, who are the majority local people, especially in their understanding and response during the health crisis when these diseases break out. So in response to COVID, the virus response by different NGOs operating across South Sudan had been top-down approach, with the most senior person asking their team to go into the village and as individual person to go and tell people in the villages individually what they can do to protect themselves. So we realized that this method does not work or will not work, given the way our communities manage their things in the past, given their level of understanding about COVID. So what communities need, and this is what we are working with the South Sudan Red Cross currently to try to do is to redesign their approach to be bottom-up approach, to send their team into the villages and organize discussion and dialogue give people detailed knowledge about COVID-19. People are lacking detailed knowledge about COVID-19, and this can be done in a form of discussion, in a form of bringing herbalists, the chiefs, and the local people together and discuss with them. Tell them that the consequence of COVID, and also the symptom and the possibility and the statistic, the data statistic, and then allow people, then empower these people with detailed knowledge, give them tools, and let them talk to their own people in a language they understand. And so in this case, we can able to make the rural areas understand the COVID and able to protect themselves, and also operate their life in a way that they can able to still raise income and protect themselves from COVID-19. So I think this is something we have suggested, and some NGOs have responded and are now redesigning their own approach to intervention in the rural areas across the country. So thank you.
All right, thank you so much for speaking to us.